Hello everyone, it's Jason with the Digital Health Wire Show. Happy hour is in full swing here at HIMSS in Las Vegas. I'm joined today by Michael Meucci, the CEO of Arcadia. Michael, it's good to see you.
Great to see you, man. Thanks for stopping by.
Yes, Michael, the word on the show floor is that we have a new partnership and it's in a league of its own. Can you tell?
What you did there.
Can you tell us a little bit about it?
Yeah, we announced a partnership this week with leading consumer experience vendor League, who is focused on partnering with leading payers and provider organizations to offer a digital solution to activate consumers in healthcare and create personalized experiences, which, if you really think about our healthcare system, is a really big gap in the way that we think about serving healthcare consumers. So as we were working with some of our customers and with other partners, it became really clear that finding pathways to get consumers more activated with personalized care insights was a huge opportunity in the market to not only improve patient experience, but patient care outcomes and cost outcomes. And League, being the leader in this space, was a natural partner for us. And the way the partnership is orchestrated is that Arcadia's data platform, which is aggregating data for hundreds of different clinical organizations across the country, 150 million patients, is the data and analytics foundation, collecting data, surfacing insights, generating those patient next best actions. And League becomes the delivery mechanism to activate those and get them in the hands of healthcare consumers in a personalized manner, ultimately creating a much more closed ecosystem where patients can be better advocates for themselves and better partners with their clinical care teams and payer partners.
And this is already live. It's officially launched here at the trade show?
Launched, yeah.
Nice,
League,
congratulations.
Actually, this event, HIMSS, is happening at the same time the League is having their executive user conference in Miami.
Oh, fun.
So it's really fun. We're kind of doing a bi-coastal launch.
Vegas is good. Miami's right there too. Those guys know how to pick them. Very cool. And then the League partnership is following up a whole suite of big news that we announced not a couple weeks ago back at Vive or around then. Kind of walk us through what you debuted at that last trade show.
Well, it's a great dovetail. So when you think about the partnership with League, it sits on top of our like massive horizontally scalable data infrastructure, our API stack. How do you collect a lot of data, generate insights rapidly, and then push them into upstream or downstream applications? That's the League partnership, and that's all enabled by Arcadia's Lakehouse platform. We talked a lot about our platform at Vive this year and a number of the extensions we activated, including our AI factory, which is our developer toolkit for AI developers. Again, the idea being we are aggregating data for the leading healthcare institutions in the country, helping them activate and unlock that data. And the AI factory is a set of developer tools that allows those organizations to build, test, and train models in an environment that is safe, secure, and has a ton of model choice. You want to use Anthropic, it's there. You want to use one of the AWS native models, they're there. You want to use OpenAI, you can do that. And again, not only just building, testing, and training, but then feeding the outputs and insights through our API stacks. You can integrate them back into your EMR, or you can integrate them upstream into League. Beautiful.
And not to say that's not enough. That's a ton of ground to cover already. But what can our viewers be excited about coming from Arcadia throughout the rest of the year?
There's a lot you can be excited about. We closed on our acquisition of CareJourney like 8 months ago, summer of 2024. And we have been wrapping the CareJourney insights. And we're one of the only data platforms that has not only access to our customers' first-party data, but now the largest claims data set in the U.S. For
possibly
Medicare.
The universe.
Not in the universe, I can promise you that. For Medicare, Medicaid, and Medicare Advantage beneficiaries. So we're creating these inside-out and outside-in views. We've wrapped that with a new contract modeling application, which we're really excited about, a network modeler, which allows you to build high-performance primary care and specialty networks. And those are really exciting solutions that we're already seeing a lot of traction on. We have them live with a number of customers. Other things that are exciting is just like bringing together the virtual workforce. We were talking about this a little bit today. Like the best AI strategies bring together deterministic, agentic, and generative AI solutions. And here at Arcadia, we've been working on implementing AI across our platform, doing things that are highly visible, like helping to activate patients directly through our patient communication pathways, helping to automate care workflows for care managers, helping them be able to carry bigger panels, service those panels better, but also doing like really mundane tasks like monitoring data quality and improving data quality. So what you can expect to see from us is this continuous push for Arcadia's workforce to augment yours, but it's Arcadia's automated workforce. It's our automated intelligent workforce that we're really excited about.
Well, it couldn't have come at a better time. We need this automated workforce. We need it now. It really seems like you guys are firing on all cylinders, and I'm looking forward to following along.
Yeah, I'm looking forward to following with you too.